When it comes to the cancer stage, it depends on the stage at which the cancer is caught. Stage 1, generally speaking, is when it is still localized to the cervix and it goes spreading. Stage 2, stage 3, stage 4, it has gone to other organs. So depending on the stage, the treatment will be determined and individualized to the patient. In early stages, the cervix can be removed as well as the uterus, and that can be the end of the treatment and the end of cervical cancer in that patient. But as the stages go higher, more treatments may be needed. So there is chemotherapy, which is using drugs. These are drugs that kill the cancer cells. And then there is radiotherapy. Radiotherapy is beams of radiation directed at the area where the cancer cells are to kill those cells. And then there is also a method called brachytherapy, which is specific for cervical cancer and some other cancers. The radiation is inserted inside the body. Most women with cervical cancer will require a few doses of that. There are applicators that are inserted into the vagina because that's where the cervix is, to reach the cervix so that the radiation can enter internally and treat the woman. But a side effect of that sometimes is that their vagina will close up. So that is a side effect. And of course, you're targeting the cancer cells. Also, normal cells get affected in the process. So treatment has its side effects, and also it is part of the high negative impact of cervical cancer. The thing about the treatment, it is expensive. It is not cheap. Surgery, even the chemotherapy, it has side effects. Radiation therapy has side effects. Then consider even the indirect costs where the woman is traveling from their home to come to a center that has radiotherapy, because radiotherapy is not everywhere. It is in a few centers, and as I mentioned earlier, the 6 in the public sector. So imagine the cost of travel. It's not a one-off treatment. You need a place to stay. So that's another cost and another stress. You're sick, you don't have a place to stay. So it is very costly. Caregiving. This means somebody has to be there to take care of you and help you. That is loss of productivity for the family. Sometimes it even involves the loss of the breadwinner of the family. Also, what tends to happen, there's a lot of trauma for women. When a woman has cervical cancer, sometimes the spouses take off and the woman is left alone, sick, unable to fend for herself and her children. It's a ripple effect that doesn't affect only the woman, but the family, the children, the community.
Chanjo huokoa maisha.